I think one of the most difficult issues affecting associations is not having the resources up front to do the kind of research that will let them know in advance whether the messages and the voices that they're going to be using in their impact communications will actually resonate with their communities. And it's all too often that great sums of money are spent without getting the response and the reaction that the association is looking for. For a limited amount of resources, it's possible to go online and test your messages with a representative sample of your community, and that gives you the confidence that when you go forward, you will be moving the needle and not wasting what you have. I think associations make mistakes in two different directions. Sometimes they oversell in volume and tone and tenor their actual accomplishments and impacts. And that's particularly perilous when you have beneficiaries who will call you out on that. Regulatory and other authorities will start questioning you. So there's the issue of overselling. There's also the issue of underselling and limiting your future, of being too modest about what you've achieved and talking to too narrow a constituency. And the ideal, the optimal, is the tone, the tenor, the volume of communications which is authentic, which is true to your impact, and is constantly reflecting on the fact that your constituency needs to grow. You need to be communicating with more people in a shareable way all the time to ensure that your base doesn't evaporate and continues to expand. The theme of my presentation was feel the impact, and I think the point I wanted to convey is that when you're communicating, you have constituencies within your community who will primarily respond to objective, data, validated impacts that will cause them to pick you and fund you over one of your competitors, let us say. On the other hand, you have constituents who are really driven by the emotional appeal of supporting you and will respond to the emotional communications that are often through third-party voices or often video rather than verbal. And I feel it's fundamentally important that your communication strategy draw from both of those and not tilt too heavily in one camp or the other. One real communications challenge and opportunity for this community, I believe, is to talk about the role you're playing in seeding clinical research over many, many years, which ultimately leads to cures or major innovations. I think if you were to poll a swath of Americans and ask them where's innovation coming from, they would either say the taxpayer and NIH or pharmaceutical companies, but very few know that in fact you as associations are making a lot of that research possible. And I think that's really a broad communications challenge that you can tackle individually and through the council.